Hello, I'm Dr. John Cruz, and today I'm going to be talking about Concerta. What's the problem with it? So I'll be answering questions if you have them at the end of this session. This will also be posted on Facebook and YouTube afterwards. So to begin with, the immediate problem or crisis is that the manufacturer of the generic branded equivalent exact form of Concerta stopped making it at the end of last year. Friday the 13th, this January, was the last day that it was supposed to be available anywhere, which is causing a crisis. So brand name Concerta is still available. There are quasi-equivalents of Concerta, and I will be getting into that in detail, available, but the generic version with the same exact delivery system is no longer available. So part of why this is more in some ways of a crisis than the Adderall crisis is that for Adderall generic amphetamine salts, there are a multitude of other makers and biologically equivalent alternatives. The Concerta, though, uses a special osmotically powered delivery system, and in the absence of, again, the brand name is still available, but the other generics there, individuals may get substantially different responses to the generics that are supposedly or not really equivalents. So I'm going to jump into the osmotic issue first and then talk about some of the, I guess, business end of it in the second half. So with osmosis, and some of this is particularly interesting to me because when I was doing my PhD work in the mid-'80s, I was doing work on circadian rhythms, biological rhythms. And one of the challenges that research posted is if you were delivering a drug and looking to see if the body was responding at different ways at different times of the day, it was hard to sort out delivering a big bolus, a big chunk, a big peak of the drug at a certain time, whether you were seeing just the result of that surge of the drug or whether you were seeing a real biological underlying rhythm in the individual. So researchers were looking for a way to absolutely constantly deliver drug, whatever drug they were investigating, at a steady rate over the study time. And I used tiny little capsules manufactured by Alza Corporation, a Stanford area Palo Alto based company that was the progenitor, the big driving force behind osmotic delivery systems, and was the original manufacturer of Concerta. We'll get into that. So Concerta is methylphenidate. It's the same active compound as generic Ritalin, but getting back to the delivery system. So the initial pumps that Alza was making, tiny pumps, they were implantable. They consist of a hard outer shell, a container inside where you could load it with whatever medication drug you were trying to study. And there was a cap on the top, and then there was a tiny hole at the top of the capsule, and the hard outer shell was permeable to water. So by the power of osmosis, and osmosis means that if you have areas of two different concentration, so more solute, more salts per volume, well, usually is the solution or solvent is water, but doesn't have to be. Water molecules are going to move of their own volition to the area of higher salt concentration to try to even things out. And if you're moving across a semi-permeable barrier, that can create forces which are employed in other fields of research. But what it means, so the Alza initial research formulation was there's a salt container in this little capsule. So it pulled in water from the outside. As that salt gel container swelled with water, it pushed the drug you were studying out at a very steady rate. And that steady rate only depended on the osmolality, the number of particles and the amount of solvent. And if you are a live human being or a hamster or a live research animal, your osmolality is within a very narrow range. If you're dehydrated, it goes up a little bit, but if it drops too high, If you're too watered out, if you're too concentrated, you're dead. So osmolality is an incredibly constant force. And what that means is day to day, person to person, the drug is going to be pumped out at a very steady way. So with the Ritalin came to market in the USA, or was FDA approved in 1955, I believe. It works well for lots of people with ADD, but for many people, its benefits last about 3 to 8 hours. So many people need multiple dosing across the day. That's a recipe for disaster with ADHD, where it's hard to keep track of things, hard to keep track of time. So a slow release mechanism, steady release delivery across the day, particularly in the 70s and 80s when they were developing this, the target market was largely children. The other advantage was a parent could give the kid medication at the beginning of the day, and with the long extended release formulation, that meant that the kid didn't have to go check in with the student nurse or get a second dose during the day. So some of the earliest extended release formulations of methylphenidate, of Ritalin, used usually the way most slow release drugs work is either they're tiny little beads and it's a coating on the outside of the bead that dissolves slowly, or it's a tablet shaped object and drug and matrix are locked together. And again, the whole pill is dissolving slowly. So it's the rate of dissolving that's determining drug release. And with matrix-based as opposed to osmosis or membrane-based approaches. So with matrix-based drug release, usually pH is a big factor. So whether the pill is in your stomach, which is highly acidic, and less acidic as you go projecting through the small intestine, how fast food is going through your body can affect how quickly drug is released. What food is in your system can also affect matrix-based, dissolving-based mechanisms for slow release. Osmosis, on the other hand, is going to be pumping steadily once it's in a aqueous, water-based environment, and is not going to be affected by the pH. It's not going to be affected largely by food intake or gastrointestinal mobility. However, there certainly can be person-to-person variability, and again, that's not related primarily to how the drug is entering your body, but if different people metabolize the drug differently, again, it's being delivered the same rate every day. Your metabolism is probably similar day to day, but it can vary from person to person in terms of how quickly you break down the methylphenidate. So also modified so in the pill that they actually developed, the membrane-based technology for Concerta, there's a firm but semi-permeable hard outer shell or casing. Inside the pill, there's one component, which is, let's call it salts. So that's the sort of osmotic pull. So that's pulling water into this container. And that salt container has a flexible membrane, so it can expand as water is drawn into it by osmosis. And then the drug-containing component or part of the pill with a small opening. So as that hard outer shell is not changing shape or volume, water is pulled into the salt-containing shape, it's expanding, it's crushing smaller and smaller the drug-containing shape and pushing it out that precisely calibrated pour at a very steady rate. So that sounds simplistic at that level, and you would think, why aren't lots of companies doing this? So a couple drawbacks or difficulties with it. Even though it's simple, this is a pretty complex engineering problem to make the membranes the right amount of permeability, to get the right pores, the right size, the drug's being expanded. So for example, Wellbutrin, which is essentially the only other primary psych medication, Wellbutrin XL, not SR, not a sustained release, not immediate release, but the XL once a day formulation, which came out 2003, so 3 years after Concerta came out. the company that made Wellbutrin XL, which was the company that made IR and sustained release, and they did it to continue their patent. They came out with the 150 milligram XL formulation. They came out with the 300 XL, and they spent more than a decade contracting it out to independent contractors when they couldn't do it themselves to try to come up with the 450 single pill, which they were likely to get FDA approval for, but never could manage on their own. So again, the engineering aspects of this are much more complex than the conceptual ideas. So downsides to the XL formulation or the osmotic-based formulation is that one, that outer shell of the pill goes all the way through your digestive system and winds up in your toilet. That can freak some people out. It can make them worry, am I really getting the drug? If I'm seeing it looks like the whole pill is sitting there in the toilet, yes, it's going there. These outer membranes, the manufacturers claim, are designed to degrade over time. So they're not contributing to the Great Pacific plastic garbage patch or anything like that. I haven't been able to find out how quickly they actually do dissolve. So the other thing, when they were in the progenitor types of forms of methylphenidate, one of the things they observed is if they only had this really steady rate delivery of the drug, one is many people were disappointed with they couldn't feel it acting at the beginning. So Concerta itself has a shell on the outside, so a coating with immediate release Ritalin. So some of this methylphenidate is going into the body right away. And then for about 12 hours, it's slowly, steadily pumping the rest of it out. And for the different dosages, and it came in strange dosages of 18, 27, 36, and 54, but no 45, so multiples of 9. In each of those dosages, about a fifth, so about 22%, is the immediate release form delivered quickly, and then about 78% is this slowly pumped out osmotic form. So again, that was well and good. Brand name Concerta was manufactured by the Alza Corporation and licensed to Johnson & Johnson in 200 and in the year 2000 when it came out, or actually Alza, well, Concerta came out in 2000. Johnson & Johnson bought out Alza in 2001, so completely took over the company and then continued making brand name Concerta for years. Then when it lost its patent, they started producing a branded generic, which means, so not only did the drug get a patent, but that special osmotic delivery system gets a patent for the company. And when Concerta went off patent, and patents last 17 years, but those are 17 years from the time of registration, which is often many years before the drug actually hits the market. So virtually nobody gets 17 years uninterrupted on the market before there's competition. So eventually, when it became Johnson & Johnson, with their drug-making subsidiary, which is Janssen Pharmaceuticals. Janssen was originally a Belgian firm, but it was bought out years ago by, since in 1961 by Johnson & Johnson. So lots of different names, same company. They started making a generic version, cost substantially less. It was being made at that time in the same Alza factories in the San Francisco area mostly. Generic became a thing on the market in the 60s, and I see sound as being an issue now. The FDA said that a generic version of the drug has to have, one, it has to have the exact same ingredient, and it has to be bioequivalent, by which they mean it has to have the same profile. So the same percentage of the drug, which is called area under the curve. So the curve is concentration in the blood versus time. The area under the curve has to be the same as the brand name drug. The peak has to be the same, and the rapidity in the first certain interval of time has to be the same rate of release. But the FDA does allow some slop, and the slop is it can be, to be biologically equivalent, it can be as little as 80%, or it can be as high as 125% of what the brand name product does. So again, initially we only had activists both made by Alza Corporation. Alza was printed on the capsule itself, so you could tell it was Alza. Some other companies decided, this is a huge market for Concerta. It was the best-selling methylphenidate product, I believe, certainly the best-selling branded market. So they wanted to cash in on it, but they couldn't use the exact same membrane-based technology, which is, again, much harder to design, much harder to manufacture than a simple matrix where you just throw everything together in a pot and lock it in. So what were initially released when other generics became available on the market and they were allowed to call themselves generic Concerta were matrix bound, again, not membrane controlled product. I'm going to back up because I neglected to say one really big drawback of the membrane osmotic brand products. So most of the time people are taught, don't ever split pills, don't break them up, don't mess with the way them pills is often a way to save costs. Most pills, including most extended release pills, if it's just tiny little pellets with the coating, which is a slow release, and the outer capsule is almost never part of the slow release mechanism. So if you have dexedrine extended release sprinkles, the outer capsule is not the slow release mechanism. It's that tiny coating on a tiny little pellet inside. So if you want a half dose, you can open the capsule, and that's not going to disrupt the slow release mechanism with a matrix bound product. However, because of the properties of osmosis, if you slice a Concerta capsule in half, that's going to obliterate the slow release mechanism. And equally confounding is that the drug is not evenly distributed through. So the left half of the pill may or may not contain the same volume or same amount, milligrams weight of drug as the right half. So Concerta and other osmotic delivery-based systems, and in psychiatry, Wellbutrin XL is the only other commonly used. There's some calcium channel blockers and a few other things that occasionally are used in psychiatry. But those are really, really pills you cannot break in half. So if you have a dose that's too much for you, you can't take 3/4 of it, you're stuck there. So getting back to marketing. So generic bioequivalent identical to the brand name was on the market. Then these other companies made matrix-based slow releasing, which were roughly similar, but lots of patients started reporting, this doesn't feel to me anything like the brand name Concerta. Enough patients complained, the FDA looked at it and said, when we're doing our testing, these may be biologically equivalent, but they don't seem to be therapeutically equivalent. That was in 2014. There were two big makers, Teva, the biggest generic maker in the world, who's the problem behind the Adderall shortage right now. And I believe Mallinckrodt was the other at the time. They were told they were given 6 months to either come up with studies showing they had therapeutically equivalent products, or they should cease and desist making it. It wasn't actually until 2021 that the FDA finally enforced some of those rules. It was, but in 2014, so it didn't take them off the market, but within several months, it took away the label that said those were biologically equivalent. And depending on state law in different states, that meant that the pharmacist couldn't just substitute in many states these generic but non-equivalent versions of Concerta for the branding Concerta. Well, they could still keep using the Activist. Over time, Activist was actually bought out by Teva, but Johnson & Johnson's in a subsidiary they called Patriot continued making a exactly bioequivalent, made in the same facilities, made the exact same way as Concerta. And the current crisis is at the end of 2022, they announced without much warning, I think it was October, they made the announcement that as of January, we're not making the Patriot branded generic anymore. Again, they're still making the brand name. Interestingly, insurance, because it's such a hodgepodge in the US and varies place to place, or not policy to policy, company to company. I've had patients who were previously taking the branded name, good generic Concerta, and they were able to switch over to brand name, and there wasn't a problem, and there wasn't even a copay difference from what they were paying. I've had patients who I went through some of the paperwork to get them brand name Concerta, and this was a Cigna plan. I'm not saying all Cigna plans are like this, but the Cigna personnel over the phone said, "Oh, it won't be any problem. Just tell them that the branded generic is not available anymore, and they'll give it to you." But when I filled out the form, the paperwork from Cigna actually came back stating the only way Cigna is going to cover brand name Concerta for this patient was, one, you have to document that there are different ingredients in the generics that are available compared to the branded name brand Concerta. And two, you have to provide documentary evidence that your patient has a specific allergic reaction to one of those compounds. And that's the only way we are going to approve Concerta for your patient. So there certainly are people who get good responses from the non-equivalent. Again, it still has the same methylphenidate, still same active component. It has roughly the same delivery, but again, if you have gotten particularly good results from Concerta, and many people did, and for years of all the methylphenidate products, that's the one I had far and away the most positive responses from the most patients to. The generics that are available now are not exactly bioequivalent. So one other footnote, and much of this is documented. Gina Pera's blog, The ADHD Roller Coaster, she's been investigating this for years and reporting on it. Her reporting is scrupulously accurate and informative and extremely detailed. So one of the things I noted is that there are a number of companies making non-equivalent Concerta in this country right now, and all 4 available doses. And when I was looking, 7 of those companies had their product approved as between 2016 as biologically equivalent, not therapeutically equivalent, in 2016 and 2020. I was wondering why that flurry of activity, particularly in the wake of the 2014 FDA saying, the Mallinckrodt, the other product, were not biologically equivalent. It turns out that this is politics. So the FDA commissioner, early in a certain administration that had power from 2016 to 2020, the commissioner doesn't think that the biological or therapeutic equivalency is much of an issue. He thinks companies should be able to do whatever they damn well want, and who cares what happens to patients. That's oversimplification, but that's essentially what his actions, who's been paying him, and what his whole career has looked like. So it was under his aegis that many of these were approved as biologically equivalent. A few of them are apparently membrane-based. Most of them are matrix-based products. And many patients report that they, again, are not getting adequate therapeutic equivalency to name brand Concerta. So there is movement and appeals to see if the biological equivalency of those 7, 8 different brands can be revoked so that pharmacies cannot, of their own volition, just substitute them when a patient comes in with a Concerta prescription. So I've talked long enough. And I see one good question. The question is, what's the benefit of Jornay PM over Concerta? So I have a whole nother talk on Jornay. I advise you to go read that. So they're both methylphenidate. They're both slow-release preparations. Jornay is designed to be taken at bedtime, and it has an outer, so it's a multi-layer. It's not using osmosis. This is a matrix-based preparation. The outer layer is designed to take 10 hours to dissolve before any drug is being released. So, and how they designed it in terms of dealing with pH and other issues means that once it starts being released, it will be released at a fairly steady rate for about 10, 12 hours, more than that, 12, 14 hours for most people. So the big advantage is For many people, their demands, their hecticness is most extreme in the morning. Most ADHD people chronobiologically are evening types, not morning types, something like 80 to 90%. So mornings are particularly difficult. So if you can take your medicine at a time, be reassured that it will be slowly traversing your system, slowly outside coding is dissolving, and then 10 hours after you take it, it will start delivering. So the other big advantage is with a little practice, you can time the evening timing your dose so that drug is being released and delivered right when you need it in the morning. So with Concerta and most of the other extended release, even though a portion of it is immediate release, many people still feel a lag. So if they take it first thing in the morning, they're still waiting for a half hour or so. So that's what I would say is the big advantage of Jornay. So several other questions. So do I think this is an indicator the brand name Concerta may be phased out of the market as well? One is they're making, so part of it, this is pure marketing and business. When Johnson & Johnson under Janssen Pharmaceuticals for brand name and under Patriot for branded Concerta, they were essentially competing against themselves in selling a product that was almost 10 times more, the exact same product. What they did is just by this move, they eliminated their major competitor, which was themselves. So I think as long as they're making money from brand name Concerta, and so far, again, this osmotic release technology for many people is a better deal, I would predict that they will keep producing brand name Concerta as long as they're making money from it. But the long-term, particularly long-term wisdom of corporate decision-making has continued to baffle me. So in the next question, hi, great. Someone watching from Iraq. I hope this is informative and my English is clear enough for you to understand. So 2 questions. Can you contrast Concerta and Vyvanse? Thanks so much. So Concerta, again, is a slow-release, osmotically delivered form of methylphenidate or Ritalin. Vyvanse is a form of dextroamphetamine, and the slowness of the delivery system, some of it is it's a matrix-based, not a membrane-based, but the big part of the slow release is that Vyvanse the dextroamphetamine is chemically linked to the amino acid lysine. There's an enzyme made in the red blood cells that cleaves the lysine from it, and that's the biologically rate-limiting step. So that makes it a very slow and regular, or steady, I shouldn't say slow, delivery system. So my experience with patients over 30 years is that the only product where people consistently say this is smooth and provides good delivery for an amphetamine-based product has been Vyvanse, and for a methylphenidate product, it is Concerta. Now, if we look at Concerta and Adderall head-to-head, and I have another talk on this, I don't know how many months ago, my interpretation of the data, and I mean, we lump stimulants as one group of molecules that are better for ADHD than our non-stimulants. But I argue that the data is pretty compelling that it's amphetamine-based products that work better, have some more common really serious side effect risks, and that Ritalin methylphenidate is actually more similar to Strattera, to duloxetine, to bupropion in terms of its percentage of people who benefit and the extent to which they benefit on our available measurements of ADHD. So if methylphenidate is good for you, Concerta is often the best choice. If an amphetamine-based product is better for you, then Vyvanse is often a good choice. I don't have any financial ties to either company. So that, I think I've addressed all the questions. Next week's topic is Intermittent fasting, I'm going to tie that into ADHD, but it will be hopefully appealing to a broader audience as well. Thank you for being here and good questions. I appreciate them, and have a healthy, happy week. I'll be back next week.